This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
Eyes come in all colors, shapes, and sizes, but subtle flaws in the way the lenses in your eyes bend can cause blurry vision. It's called astigmatism. It's a very common flaw, and according to Dr. Todd Bescak of Chesapeake Eye Center, very easy to correct.
This is by far one of the most often questions I'm asked at parties or socially.
Dr. Todd Bescak of Chesapeake Eye Center hears it all the time.
People come up to me and they say, I have astigmatism. What am I going to do?
It sounds serious.
It has stigma right in the middle of it.
But Dr. Bescak says it isn't.
I'm going to break it down simply. We have a model of a human eye here.
Using a model, Dr. Bescak shows the two lenses of the human eye.
So the very front of the eye is called the cornea. That's if you poked yourself in the eye, that's what you would hit. That is one of the lenses of the eye, right? And then inside the eye, back behind the iris, or the colored part of the eye, is the human crystalline lens. They're both round structures, right? They're both like a sector of a ball, if you will, like a ball got kind of cut, a basketball, if you will.
He says in a perfect eye, it is shaped perfectly round.
But in an eye with astigmatism, it is more oval in one direction, kind of like a football. Football is being dramatic, but it's certainly not as round as a basketball. So when you have that non-uniform roundness, there's an astigmatism. It can occur in the cornea. It can also occur in that human lens I was telling you about.
Like most conditions, Dr. Bescak says there are varying degrees of astigmatism.
You could have a very tiny amount, up to a medium amount, up to a very large amount.
He says the result is blurred vision.
So that's simply what an astigmatism is. It's not a disease process, nothing's going wrong.
In children, astigmatism can cause the eye to not develop correctly.
Meaning if you're not getting a clear image on the back of the retina, and you don't clear that by the age of like 8 or 9 years old, you permanently have blurred vision. That's called a lazy eye or amblyopia.
Dr. Bescak says that's why routine checkups are so important.
Especially in that first decade of life, because we can pick up on things like blurred vision.
And that's when glasses are in order.
Basically what we're doing is we're taking that longer axis, we said it's a little bit oval, and we're counteracting that with a lens that's positioned the other way. That clears the image on the back of the eye.
He says contact lenses work too.
Contact lenses now correct for astigmatism. They have for some time, but they're getting better and better and better.
Another option, surgery.
Like I said, there's small, medium, and large amounts of astigmatism. If you're small or medium, LASIK or PRK will take care of it, no problem. It's only when we get into those bigger areas that maybe we can't do enough lasering to counteract that abnormal curvature.
Dr. Bescak says the advantage to surgery is they can actually fix the problem, where contacts and glasses only correct the vision.
We're correcting that curvature by having the laser remove a very calculated amount of corneal tissue in order to create a more round cornea, if you will.
Unfortunately, not everyone is a good candidate for LASIK. Dr. Bescak says the perfect age is in the 20s or 30s.
Once we get beyond that, some aging changes happen to the eye, and probably the most dramatic one is a cataract forming, right? So once I see any degree of cataract in the eye, and that's a clouding of that lens on the inside that I was showing you, then I would tell you that you're not a candidate for LASIK anymore.
Dr. Bescak says certain diseases can create astigmatism too.
For instance, there's a disease called keratoconus, where your cornea starts thinning out, okay? We don't know why it happens, but we know that it does. And if it thins out in a specific area, usually the lower part of the inferior part of the eye.
For that, Dr. Bescak prescribes a hard contact lens.
You don't see those as much anymore, but there are contact lenses that can control the cornea so it doesn't curve more than it already is.
Astigmatism may sound scary, but if you look past the big word, Dr. Bescak says it's easy to correct and get you to seeing clearly again. And Dr. Bescak adds that astigmatism can also be fixed during cataract surgery.